Om Namo Narayana, dear brothers and sisters. This is Dr. Shivani Singh, Chairperson of the Ramakrishna Clinic and also an ICU specialist. I would like to, on behalf of the Ramakrishna Clinic of South Africa, reiterate the issues surrounding COVID during July and the coming months. The surge in KwaZulu-Natal has now commenced. We are already full to capacity in many of our public and private hospitals, with the capacity for beds, equipment, and staff being rapidly outstripped as we see overwhelming numbers strangle our healthcare systems. This has been seen over the last 2 weeks, and we are already struggling. Higher number of people in the community are testing positive and requiring hospital treatment. ICUs are filling up. The gravity of the situation lies in the fact that there is such a rapid multiplication of admissions. Patients have to stay admitted for prolonged periods, and at the same time, many more are doubling in terms of admissions. The medical and nursing staff are already struggling to cope under the demands for this in our early wave. We will be no different from the situation seen elsewhere in the world and our country, as our systems are not as robust as theirs. And with these patients the patients can be fine and rapidly deteriorate over hours, needing ICU assistance. I would therefore like to urge and reiterate all aspects of prevention and self-care to be strictly adhered to by the public during this time. The wearing of masks, frequent sanitation of hands, frequent hand washing wherever possible. Wearing a mask is not enough. Reducing the time spent outside with the lockdown being lifted, interaction with people at work and during commuting all need to be done with the strictest protection if they cannot be avoided altogether. July and the coming months are our season for flu and other respiratory diseases. This, with COVID, places us at the most vulnerable time. It is the responsibility of everyone to maintain and protect themselves and others. If you do not care about the infection to yourself and others, you are placing a burden on a system that is already struggling. Think about the risks to you and your loved ones at home, the risks to those aged over 60, and patients with existing illnesses. There is still no specific treatment for this disease. There is no vaccine as yet. And until this time, we have to become accustomed to this new world of masks and sanitation. The greatest risks exist when going out, touching things whilst shopping or working that are touched by others, and then touching your face and eyes and therefore contaminating yourself, not maintaining the distances of social distance, and not wearing the mask. Whatever risk you place to yourself is carried to whoever you come into contact with, as well as your family. And this is especially so even if you have no symptoms. If you have symptoms, you should be isolating at home and speaking to your doctor. Be careful of what is being contaminated at home. Cleanse goods that come from your outside. Ensure that your cell phone, keys, wallets are all regularly sanitized. Ensure you wash your hands and bathe as soon as you enter your home, and change your clothes if that's not possible as soon as you get there. There is no excuse for not maintaining these standards since the lockdown has been lifted largely for economic reasons. We see in our daily movements breaches of this happening. It is our duty to make others aware of when this is happening, to ensure that they maintain the safety protocols and advise others of where this is not happening with correct information and assist them safely where needed. We understand the fatigue and emotional stress that has been in existence during the lockdown. However, we cannot relax measures, especially now when our province is affected and when the surge has reached us. The Ramakrishna Clinic, although we cannot undertake medical outreach work to the extent that we did before, is still continuing to provide relief, both in the form of comfort and food hampers to different communities and people. And wherever support is needed, please let us know, and we can try and assist where possible. May we all be safe during this time, and may we all be in the protection of the Lord with self-discrimination and self-effort. Om Namo Narayanaya.